welcome back. So yeah, nice to see all of you back. And a few things before we start. Okay, as usual, this is our series of endometriosis, and I hope you're not too bored with endometriosis. You have missed, some of you may be new in this 9 p.m. live video. If you have missed the rest of the endometriosis videos, you can just browse through my Facebook and you go back my Facebook and you get to see some. And if you don't see them there, you will be able to see it in my YouTube channel. Alright, so that is endometriosis. And next is also just to inform all of you that I'm actually very excited to get vaccinated 2 days from now. I'll be vaccinating on Tuesday. Oh, I'm so excited that I'll be finally getting it. Okay, for some of you who have not, I know you all are mostly not frontliners, so you don't know what it's going to be like. Okay, so what's going to happen is, first thing, when you register with the My Sejahtera, then you're supposed to have the registration page. And once you get that, of course, you just sit down and wait. And then, as usual, when we did that, we're all wondering, when are they going to call us? When are they going to call us? Are they actually going to call us? Will my notification actually come out? You know, we have our My Sejahtera app in our phone for so long, but I've never seen a single notification from My Sejahtera app. So we wonder whether the notification is working or not. So that day, a couple of days back, when I woke up in the morning at 6:45 in the morning, and I look at my phone, first thing I saw, why I got a notification from My Sejahtera app. And yeah, the first thing they want you to do is to fill out a questionnaire. This questionnaire is to actually write about your any of your illnesses that you have that they may consider whether you can or you cannot have the vaccine. So they actually ask a lot of things. So because a lot of mothers asking me, now I'm trying to get pregnant, should I register with My Sejahtera? So I always say, register only lah. You also don't know when you're pregnant. When you get it, they will ask you this question. Then you can always say, I'm currently pregnant, so you reject it lor. If they don't give you a date and time first, they will ask you about a health survey first. So a health survey asking about all your current condition, and based on the health survey, they'll tell you whether you qualify, and once you're eligible, then only they give you a date and time and a venue where to go for your vaccine. So for those of you who are planning for pregnancy, especially a lot of the endometriosis women, because most of endometriosis women, they don't actually get pregnant so easily. And if you keep waiting and waiting until when you want to wait, right? Let's say maybe you're still not pregnant by end of this year, you have got yourself vaccinated already, but of course I hope that you will be pregnant lah. Then you're pregnant, there's also no issue. Then you just tell them that you're pregnant already lor. That is no problem at all, okay, because we don't actually know when you're pregnant. But for those of you who get pregnant easily, like one of my staff say, doctor, I'm trying to get pregnant, should I register? I say, you so easy to get pregnant, don't get pregnant now lah. Okay, so get pregnant later, get pregnant after your vaccination is over. Because so for some of you, it's like, today I want to get pregnant, I will get pregnant once. So then wait another few more months and get yourself vaccinated first, okay? Because in pregnancy, COVID-19 can be quite bad, and when it's quite bad in pregnancy, so hopefully we want to avoid you getting COVID completely during your pregnancy. So it's better to vaccinate first. But for those of you who have been waiting so long and worry that you may need a bit of time before you can conceive, then I think you just register for the My Sejahtera for the vaccination, and let's see when it happens, okay? And there was also one question that I saw. Can endometriosis people vaccinate? Of course you can. Endometriosis is not one of the contraindications for vaccination, which means that it's totally safe to vaccinate when you have endometriosis. And endometriosis doesn't affect the vaccination, and the vaccination also does not affect endometriosis. So if you have endometriosis, you just go ahead and vaccinate. There's no issue at all, okay? So let's go through some of your questions on endometriosis. So, okay, yeah, where's your questions? So today, the last few rounds, I have been answering questions that is asked by the endometriosis group. So today, I'm not going to do that. I'm going to come back to you all, the ones who are following my Facebook. The questions asked by you all over the last few endometriosis videos. So we had a couple of videos the last few weeks, and I have not yet answered some of your questions, okay? So as we know, I have already completed quite a lot of things on endometriosis. I've completed how you actually can detect endometriosis, especially those how would I say, those endometriosis that are still in very early stages. What is deep endo scan, and why is it that most of the time in your endo people will say you're normal because your scan is normal, because nobody did deep endo scan for you. So what you need is to do a deep endo scan. And then I cover medical treatment of endometriosis. I also covered surgical treatment of endometriosis, and I also cover the big five, which is what is a complete endometriosis treatment, which does not just involve surgery or medicine, but a lot of other things that you need to also have the complementary treatment of endometriosis. So what are the other things that you need to do if you have endometriosis to fulfill the complete treatment? Because only if you fulfill the complete treatment, then only endometriosis do not come back. If you do not have a complete treatment, the endometriosis always come back. Always come back is something that I want to get through to you all, because even though, yes, we know some people don't get it back, but we need to remember it as always. Then only we will make sure we take all precautions to make sure it doesn't come back, because getting endometriosis back is actually very, very common. Okay, now come to the question of Amy Chu. Amy Chu asks, Doctor, I am in my late 40s. If I have endo and I don't intend to have any more children, what is the best solution? Remove uterus and ovary or go for medication? Okay, so normally I would say if you're in your late 40s, you actually have a few things you need to think about. First, I want to know whether the endometriosis is affecting you. That means, are you having a lot of symptoms? Are you having a lot of pain? Is it causing problem on your kidneys? Is it causing problem on your breathing? Is it causing you a lot of problems? If let's say it's not causing you any problem and you're in your late 40s, that would also help me to do advise what you need to do. So it's not just your age and whether you want to have baby. Next thing is whether it's causing you any trouble. So because in late 40s, some of people will actually choose not to do anything, because we know endometriosis goes away after you menopause. So it goes away after you menopause. So you can actually choose not to do anything, because eventually you will menopause and endometriosis will go away. So you can choose not to do any, provided few things. Number one, it's not causing you trouble. Number two, it is not too big, because when it's big, I'm always worried about cancer. We talk about the cutoff point of 3 centimeter. Anything more than 3 centimeter, there's cancer risk. Less than 3 centimeter, you are 100% safe, no cancer. But more than 3 centimeter, you have cancer risk. So you have to think about it, you know. And cancer tend to come with older women. So when you're talking about late 40s, you're considered older women, because endometriosis goes away after menopause. So most people who get cancer from endometriosis are usually also in their 40s. So I will also think about that. So if it's not giving me any problem, and it's also very tiny, I can choose just to wait and don't do anything, because I wait until I menopause and then you go away. Okay, then second option is whether I want to take medication. Of course, medication is a good option, but you need to take until you menopause. If you're in your late 40s, then it's not long after you won't menopause too late, hopefully. Some people menopause when they're 60, you know. My aunt menopause when she's 65. Oh my god, I don't want to menopause when I'm 65. So, yeah, so you are going to continue medication until you menopause. That's the only thing you need to ask yourself. Are you willing to continue medication until you menopause? So the question is there a problem if I continue medicine until I menopause, or is there an advantage? The advantage of taking medication is that I suppress the disease. I suppress the disease. Let's say now the disease the cyst is not very big, everything is not very big. I suppress it so it don't get worse. It don't get worse, it don't get bigger, it don't turn cancer. I think that is also very important. I want to suppress the disease. But at the same time, that is the advantage. That's the main advantage. Number two is the pain that you're having and all the suffering that you're having. Because if you take medication, then the pain will go away. Whatever you're suffering, it will go away. So that's why I say the two things. Is it disturbing you? Are you suffering from it? Or are you worried about cancer? So if you take medication, then these two problems is solved. But do you have any side effects taking medication long term until your menopause? Yes, because all endometriosis medication is some form of hormone therapy. And the hormone we talk about, as I talked about in my medical treatment for endometriosis, is actually progesterone. So when we talk about progesterone, then what are the one thing that we worry about progesterone? We only worry one thing. What's the one thing we worry about progesterone? We know that hormone treatment doesn't matter whether it's progesterone or estrogen or any hormone treatment. There's one thing: the blood tend to be thicker. Blood tend to be thicker. Then when blood tend to be thicker, we also worry about, what do we worry when the blood is thicker? We worry it block our blood vessel. So we actually worry about things like stroke, heart attack. We worry about blood vessels being blocked. And then you're like late 40s, and then you're going to take like so many years, and then your blood is going to be thicker. So we also worry. So we need to look at a lot of things. Let's say you are 20 something, 30 years old. We are not so worried about this stroke and all these things because you're young, and maybe you're so much healthier. No high blood pressure, no diabetes. Your weight is normal. You have no cholesterol, high cholesterol. So, but if you're in your 40s, number one, your age is higher, and then don't know, maybe you got high blood pressure, a bit of diabetes, and maybe your cholesterol also be high, and maybe you're also a bit overweight, and maybe also your life very stressful. You have so many risk factors to get stroke, and then plus you take hormone, that of course the risk is higher. So we have to also think about that. So there's no pros and cons, right? I mean, there's always pros and cons. There's no perfect method, isn't it? And then the last option is to go for surgery. Go for surgery, you mentioned in this question, Amy, is that should I remove my uterus and ovary? Of course, if you remove your uterus and ovary, your endometriosis settle once and for all, never come back. But removing uterus and ovary also has its own problem. What are the problems when you remove uterus and ovary? No uterus, no issue. No uterus, no issue. Uterus is no use. Uterus is only for baby. But ovary is a problem. Because ovary, when you don't have, you have no more hormones for the rest of your life. So let's say you're going to live until 80 years old. So the first 40 over years of your life, you have hormones. And the next 40 years, you have no more hormones. So that is also not so good. Because hormones is very important for women. So that is also not the perfect thing. Then your next question is, can I remove my uterus, don't remove my ovary? Endometriosis, the most important thing is the ovary. Because the ovary provide estrogen. I think if I mentioned to you earlier, it's the estrogen and the progesterone thing, So endometriosis, we don't want estrogen, we only want progesterone. And then ovary has both estrogen and progesterone. In fact, it has more estrogen than progesterone. And as a result, if you keep your ovary, then you still have estrogen. So even if you remove your uterus, you keep your ovary, endometriosis will still come back. So then there's no difference. If I were to remove my uterus, I keep my ovary, it will still come back. So then what are you going to do? There is no difference compared to, let's say, you do a surgery, you still keep your uterus and keep your ovary. Just like the younger people, they keep their uterus, they keep their ovary, they just remove the endometriosis and all the adenomyosis, everything they remove, but they keep their uterus and keep their ovary. No difference one. So if you take out your uterus, you keep your ovary, or you keep your uterus and your ovary, no difference one. Everything also got chance to come back. Then we talk about the complete treatment that I mentioned in my last video. The complete treatment to prevent endo from coming back. You probably need to do that. Okay? You probably need to do that. So, or unless if you're lucky, you're in your late 40s, we say if you have a complete surgery, not remove uterus and ovary, but complete remove all endometriosis. That actually takes a long time. It takes 5 to 10 years before endo come back. So a lot of women who do that, actually they're very lucky. The endo don't come back because maybe another 4 years you menopause. It takes 5 to 10 years to grow back, but 4 years you menopause already, so problem solved. So that is the 3 options you have. In fact, recently I saw a few endo patients, and that is what I told them, and they're all in their 40s and all already don't want to have babies. So I told them that is the 3 options you choose. You either choose conservative management, means what also don't do, I just wait and see if I'm lucky enough, maybe it doesn't worsen, it doesn't turn cancer, and I'm not suffering, it's fine. Or you go for medical treatment, or you go for surgical treatment. But if you choose conservative, I can still help you in another way. Conservative treatment means you're not going to take medicine, you're not going to do surgery. But you could always still take the complementary therapy that I mentioned the last talk that we had, which is what you call that, going for diet treatment, going to see my dietitian to go for diet adjustment, physiotherapy, and what do you call that, psychologists or therapists. So basically we want to reduce your stress, teach you to relax the muscles that causes more pain in endometriosis. At the same time, what do you call that, dietitian, dietary changes. So some of you, if decided to choose not to do anything and you're already in your late 40s, it is a possible option, as long as you're not suffering and the cysts are not too big, you're not worried about cancer. It is a possible option, but you can supplement it with lifestyle changes. That is to see therapists to reduce your stress, to learn certain exercises that will help in reducing your pain, and at the same time to control endometriosis with dietary changes. So that is one thing you can do as the first option, that is you do not want to take medicine or do surgery. But do medicine has its advantage, because then you control the disease. It will not worsen with time. Just in case you don't menopause in the next 3 to 5 years, maybe you menopause in another 10 years, then it can get worse and worse. So if I take my medication, it doesn't get worse, and I do not worry about becoming worse and becoming cancer, and then whatever pain I'm having will be solved because I'm on medication. But only thing, it runs one tiny risk. Actually, it's a tiny risk because it seldom happens. That is, we worry that you will get blood thickening effect, which causes stroke, or else then you go for the surgical method, whereby you have to have the complete treatment, which I mentioned in my last visit. You need to clear endometriosis completely, and then at the same time go on some maintenance therapy or preventive therapy, which includes medication. What do you call that? But this medication that you're going to use, usually for prevention, we don't use such strong medication, so which is a lot safer. And same dietary changes, physiotherapies, and psychological therapies. So you do all this, you have a complete surgical treatment, complete treatment for endometriosis after your surgery. Then your chances of it coming back will be so low, and you will be able to go on for the next 5 to 10 years or even longer. Because even young women in their 30s or 20s, if they do that properly, they can be free from endometriosis even for the next 20-30 years. Just like myself, I had surgery for endometriosis 20 years ago and it never came back because I went through the preventive therapy. Understand? So that is the options that Amy Chu have. Sandra Leo asked a very interesting question. She said, fibroids and endo, which one is the most difficult surgery to do? Actually, if you ask me, fibroids is kacang putih one, because fibroid is actually very easy surgery and hardly any risk involved. The only thing we worry is bleeding, but we know that bleeding in fibroids can be solved and prevented. It's totally prevented if you do the precaution before you operate. So that is totally preventable. So there's no issue. There's no issue about bleeding in fibroids. Fibroids is actually a very easy surgery to do, but very tedious if you're doing it by keyhole. Of course, if you do open surgery, fibroid is very easy lah. Very easy surgery and can finish very fast. It's like so easy a surgery to do. It's like the easiest surgery you ever have to do is fibroid surgery. But if you were to do laparoscopic or robotic, it's very tedious because it takes a long time. It takes many hours. It's very easy, but it takes many hours to do it, because sometimes you don't have one fibroid, you may have many fibroids. If you have 10 fibroid, we take out one by one. It's so tedious, but it's just tedious, just tired, that's all. But it's very easy. Endo surgery, no, because endo surgery you have a lot of unexpected possible complications during the surgery, because before you go in, you don't know whether the endo is at the kidney or not, at the blood, the bowel or not, at the lungs or liver or where it is. You don't know until you go in. And then when you go in, then you see, oh, got this, got that, got this, got that. You have to try and solve the problem, right? You aim to remove. Of course, if you don't remove all, like a lot of times doctors just take out the cyst and leave everything on the bowel and on everything. They say it's very dangerous, don't touch. So they will tell you, I'm sorry, I mean I remove all your cysts, but there's still a lot of endo in the bowel that I didn't do anything. They will tell you all these things. Yeah, of course they never take the risk to remove it, but honestly to me it's risky only when you're not trained. If you're trained to do it, it's no longer risky. So that is why you need to be trained. I always say you need to be trained. If you ask the urologist, is it dangerous to cut the bladder or the ureter, you say it's not dangerous. They know what to do, ma. They every day cut ureter and bladder one. What is the problem cutting ureter and bladder? No problem, one. They will just cut. Okay, it's just like you ask the bowel surgeon, colorectal surgeon, is it dangerous to cut the bowel? He every day cut the bowel, ma. He's not worried cutting the bowel. So the question is, are you trained to do this type of surgery? If you're trained to do everything, actually endometriosis surgery it can be very complicated, but as long as you're trained, it's not so bad. But as usual, there's a lot of unexpected things. So every single endometriosis you go in, you have a lot of unexpected things. So sometimes you scan, it looks like not too bad, then you go in, it's like wow, so bad. And then sometimes you scan, you think it's so bad, then you go in, it's not as bad as the scan shows, because scan does not show so clearly exactly where all the endometriosis is. So a lot of unexpected surprises during surgery. So the surgery is definitely not as easy to do compared to fibroid surgery. Fibroid surgery is like the easiest surgery to do in this world. Okay, so that's the answer to your question. Okay, next question is from Nazira Gulam Muhammad. I had removed endo successfully, pregnant after 3 months of lupine. That's wonderful. And that's actually exactly what happened to me as well. I had endo, I did my surgery, I did 3 months of lupine, and then I conceived. My menses came back 6 months after delivery. I am still breastfeeding. I'm concerned about endo reactivating since I already had my menses about 1 year. Please advise. Yes, I always tell women one thing. When you have endometriosis and you have done whatever treatment that you have done, whether it's a surgery, whether it's medical treatment, whether it's IVF, if you are already pregnant, after you give birth, don't forget about your endometriosis. A lot of women, after they give birth, they forgot endometriosis. Don't ever forget about endometriosis, because endometriosis will definitely come back. I have seen so many, trust me, so many mothers, surgery, pregnant, not pregnant, surgery again to get pregnant. Oh my God, you already had surgery, you got pregnant, and then after that you cannot get pregnant, you have to do surgery again. Isn't it sad to know that? So you see, never forget about your endometriosis, even after you give birth. I also had this one lady who came and see me last year. Couple of years back, she got pregnant and she gave birth, and I told her, endo will come back one, please put in your Mirena. She said she don't have baby, she got enough already. She had 2 kids, and to her that's more than enough. Before she's pregnant, we still see a very tiny cyst, but when she's pregnant, of course the cyst disappear. So after she give birth, then she scanned, there's no cyst. So she thought she's fine. Then she didn't want to, I asked her to put in a Mirena. She said, wait, I think her weight, I think, came back 3 years later. She think for 3 years. Then suddenly she appeared in my clinic. Why? Period pain again, lor. Why? Pain come back, lor. 3 years later, come back. Then I look at her and I just smile only. Then she know exactly what I'm going to say already. So immediately she put her Mirena. Because I already advised you already. Now it's so big, come back and so big again. So there, endometriosis always come back. Of course, for her it's still fine. She doesn't want any more baby anymore. The cyst come back, she can go on medication for a certain period of time, then convert to Mirena, and that's it. But what if you still want another baby? Are you okay if you don't have another baby? Because some of them, that's what, when they see me, that's what I tell them. Depends on what you want, no? If you have to have a second baby, then the answer is another surgery, or don't want surgery, then must accept the fact that you can't have another baby lah. Let's start medication, no point waiting, because you wait also you can't get pregnant anyway. Because the endo already did not allow you to get pregnant. You've been trying for a few years already. Continue waiting is just a waste of time. And not only that, your disease continue to progress. That's another thing. A lot of women make a mistake there again. They want to get pregnant. They already tried 1 year, 2 years. They're not pregnant. They have endo, they know. And they still wait another 1 year, 2 years. Don't do that. Because the disease continue to progress. And because the disease continue to progress, it damages more things inside. You must understand, endometriosis damages your ovaries, your tubes, your uterus. And it keeps spreading to more and more places. And if let's say today is only 1 ovary and 1 tube, and then because you keep waiting and waiting and waiting, become 2 ovary and 2 tubes. So we don't want that. So if already tried for like 1 year, 2 years, no baby, don't wait already. Don't try anymore. Don't wait for the baby. You're not waiting for baby. The disease continue to progress. And when the disease continue to progress, what if it reach a point where there's no more hope? Where there's no more hope in getting pregnant anymore. Endometriosis can reach a point where there's no more hope, or literally you need to hope for a miracle. Don't wait until your endometriosis worsen until there's no way you can conceive anymore. So don't wait. That's why a lot of women just keep waiting. Wait until they really desperate already, then only they're willing to do surgery. But then when they do the surgery, when we look at the surgery, when we go in and look at them, we feel so heartsick, because we want to help you to get pregnant. But you come to aid us at such a late stage where there is no healthy ovary left, there's no healthy tube left, and there's no healthy uterus left. What is left for you to get pregnant? Because when we remove endometriosis, every time after the surgery, I already more or less know whether this person can get pregnant or not. I already more or less know whether you can get pregnant or not, whether you can get pregnant on your own or not, whether you can get pregnant with IVF or not, or there's no way you can get pregnant. And the surgery was just buying hope. We know because we see how much of damage has happened. Wherever the endometriosis goes, once it damaged, the damages are beyond salvage. So it's not just about a cyst or an adenomyosis. It's not just as simple as whether there's a cyst or an adenomyosis. We want to have healthy ovaries and healthy tubes and healthy uterus ultimately. If you have healthy ovaries, you can still get pregnant. If you have healthy tubes, natural pregnancy is still possible. If you have healthy uterus, then you can get pregnant. If your both ovaries are not healthy and the entire uterus is not healthy, it is almost impossible. Especially the uterus part. That's why I also see a lot of women initially, or they have a cyst in the ovary. They didn't want surgery. They try this, try that, all trying to get pregnant. Then 2 years, 3 years down the line, now they got adenomyosis. Because when adenomyosis comes, then the uterus is affected already. When the uterus is affected already, then you must understand that depends on how much uterus left. When adenomyosis comes in, we want to know how much of the uterus is affected by adenomyosis. If it's only 10-20%, no issue. Go and do a surgery, dig it out and stitch back. You still have a healthy uterus to conceive. But with you, when you come to see us, your adenomyosis is like 70-80% of your uterus. You only have 20% left. How to get pregnant? It's like almost impossible, whether IVF or natural conception. That is why when you have endometriosis and you want to get pregnant, or you may want to get pregnant one day, because today I got one lady, she's only 30 years old. And she's single, she says, and she has no intention of getting pregnant anytime soon. There's nobody in her life at the moment. So she say, if maybe I may not get pregnant forever and ever, is it okay if I just leave it alone? Then I told her, are you 100% sure for the next 20 years you're not going to get pregnant? Are you 100% sure that 5 years down the line, if there is a Mr. Right guy and you don't want to marry him and you don't want to get pregnant? If you are not sure, please keep a healthy uterus, ovary and tube for yourself. Because 30 years old is still very young. You can still meet the Mr. Right guy at 40. If you're 50 years old or 45 years old, maybe you can talk like that. 30 years old, even if you have given up with all the men in the world, you won't know the Mr. Right guy can still appear in front of you 5 years from now, right? So no. The moment you know you have endometriosis, irrespective how old you are, especially when you are young and you have no children yet, very important, you need to start treatment early. So that hopefully when you start treatment, at the point when you start treatment, your uterus is still healthy, your tubes are still healthy, and your ovaries are still healthy. Then definitely you can conceive on your own. You don't need any help later when you want to get pregnant. Don't wait until everything is already in very bad state before you come and see us. That time sometimes we want to help you, but you didn't leave anything behind for us to help you. You understand? You leave behind ovaries that are so tiny already, all damaged by endometriosis. You leave behind the tubes that are entirely whole length of tube already attacked by endometriosis. You leave behind a uterus that is totally infected by adenomyosis. How else do you expect us to help you? Alright. Tubes at least not too bad. I can always just don't want the tube and then just go for IVF. But ovary, you still need to give us some good ovary to help you. You still need to give us a relatively healthy uterus to get pregnant. So that is my story about treatment on fertility, endometriosis with fertility, because I've also seen 2 cases so far, not operated by me, but they came to see me for opinion only. Both these cases is the same story. They have adenomyosis and they have been operated multiple times for the adenomyosis and eventually done perfect work, total clearance of adenomyosis. There's no more, only healthy uterus left. But unfortunately, the uterus is so thinned out that she can't get pregnant on her own is one thing. She went and see IVF. No IVF doctor want to do IVF for her. Because when we scan the uterus, we know this uterus, if she gets pregnant, she can die. The uterus will just rupture. It cannot hold a baby for 9 months. So that is why, very important, you must treat the endometriosis early. We don't care what treatment you use. You want to do surgery, you do. You want to take medicine, you take. But you must be on something. Not don't do anything. Understand? Okay? Alright. So the advice for Nazira is please go and see your doctor and get something done. Don't sit around and wait. Your endo will come back, and then if you want to have a second baby, you may end up operating again, which is very sad, you know. Because the sad thing about endometriosis, people keep operating again. I think we should target our aim, our ultimate aim is anyone who walks into surgery for endometriosis should only be operated once. Which is what I explained in my last video, the complete endometriosis treatment. Everyone should be on complete endometriosis treatment until menopause, so that you will not be operated again and again. Medical treatment is fine, not too bad. It's just that I feel very sayang. Okay, you have a 4 cm cyst and then you took Visane for 2 years. After 2 years, no more cyst. You happy already. You stop medication. 2 years later, your cyst come back. And again 4 cm. Then I'm like, why did you stop leh? You still have to do other things. Yes, we say cannot take forever. We say cannot take forever. But there's so many other preventive medication ma. Why did you not switch to preventive medication? Because for endometriosis, medication is until menopause. You do not stop medication. You can switch. You can switch from stronger medication to milder medication, from medication that uses for treatment to control to prevention. I always say medication for endometriosis 3 types. You got treatment, got control, got prevention. So you can switch. You don't have to like stick on Visane forever, but you don't stop. So when she stopped, it's like, I just yeah, that's what I always do. Now we start all over again lah. You took Visane for 2-3 years. Now let's start all over again lah. Take Visane again for the next 2-3 years lah. I also seen people who put a Mirena and then decided, I heard Mirena no good lah, and take out Mirena lah, go and put a normal IUCD, and then after that come back and ask me why now I got period pain, and then after take out the IUCD, period pain still there. Obviously your endo come back lor. They have to put back Mirena again, but it's still okay. You see, start medicine, stop medicine, eat medicine again, it's still okay. But it's not nice to do surgery and do surgery and do surgery again. So please, when you walk into the operating room to do a surgery, you need to be on the complete treatment, complete endometriosis treatment. Don't just do a surgery. Question yourself, question your doctor. Did you remove all the endo in my bowel, in my bladder, in my ureter, in appendix? Did you get a complete clearance? Not just take out the cyst. If your doctor say, oh, that is too dangerous, we don't do that, we just give you medicine, after that change doctor. Okay, you want to get your disease, if possible, remove 100% of disease or 90% of disease, not just remove 30% of disease and leave behind 70% of disease for it to spread and spread and spread. So that is one thing. Always get a complete surgery done. Medication to prevent the endometriosis from coming back, dietary changes, physiotherapy, psychological therapy. This is the complete endometriosis therapy. You need complete treatment so that you don't walk back into the operating room. If you have fertility issues, you need to know what to do for fertility. If you have got pregnant after surgery, good news, but don't forget about your endometriosis after the surgery, okay? After your baby is born. Barbara asks, can lupine affect women's fertility after? No, I do not know what she means after expiration in the body. No, lupine has no effect on fertility at all. Okay, Carissa, you asked a very interesting question. Not many people talk about this. Doctor, can you explain if presacral neurectomy help with adenomyosis? Okay, let's talk about presacral neurectomy. What is presacral neurectomy? Presacral neurectomy is what do you call that? Presacral neurectomy is where we cut away some of the nerves that is the transmitter of pain. You see, your pain starts with the endometriosis. It's all from your endometriosis, okay? Your endometriosis causes inflammation, so it stimulates the nerve to go to your brain to tell you there is pain. So one of the nerve, you can actually remove it, part of the nerve you remove it, then this whole nerve cannot tell you pain anymore. So even though endometriosis is there, you don't feel the pain. So does it help? Obviously no. It helps you with some pain, but not all pain. Because in endometriosis, not all the pain is from adenomyosis. It can be pain from other parts of your body. It can be pain from endometriosis in another nerve. It can be pain endometriosis in your muscle. It can be pain endometriosis in your tubes, in your bowel, in your other places. So it can be anywhere. So if you just remove that one nerve or two nerves, why you got new nerve? Or maybe I remove this nerve and you have no more pain, but endometriosis continue to spread. You can go to another place and another place and another place, and then another nerve is now affected. Then the pain still come back. So we know in presacral neurectomy, it is only a temporary pain solution, but it does not solve your endometriosis or your adenomyosis, which means that your endometriosis and your adenomyosis will continue to grow and continue to spread and continue to cause problem. So that's why we don't actually do this surgery. And to remove a nerve at such a deep structure is also a very, very invasive surgery. Why not just remove all the endo rather than remove the new nerve only but leave the endo behind? Okay. Amy Juan asked about Yasmin. Is Yasmin for prevention too? Okay, so in Yasmin, you actually have two hormones. I think I mentioned earlier, for endometriosis treatment, we need to use progesterone only, no estrogen. No estrogen, we only want progesterone. That's what treatment. For treatment, for control, yes. For prevention, it's also preferred to use progesterone only. So that's why oral contraceptive pills like Yasmin is actually not advisable for endometriosis. But it is more advisable for someone who doesn't quite have endometriosis or not too much of endometriosis, like very, very little. So because Yasmin does work for prevention, but may not be as effective compared to for someone who already have endometriosis. Let's say I totally have no endometriosis. So from today onwards, I take Yasmin for the rest of my life. Then I won't have endometriosis. That's as simple as that. But let's say I already have endometriosis, but only very, very little. Then I take Yasmin. That's fine. But once you have more and more endometriosis, actually we do not advise any form of oral contraceptive at all. I mean, especially things like Yasmin, that we call it combined oral contraceptive pill. Combined because combine two hormones, estrogen and progesterone, so it's combined. So because today I also had one lady, she was operated by me. Actually, I was the second surgeon. She was operated by one doctor, but after that doctor, she still had a lot of period pain, so she came to me, and then I operated for her again, which is like 1 year after her previous surgery. And I went in still very bad, a lot of disease still left behind. So we cleared up everything, and then she was pain free already. After that, her period has no more pain, and then she got pregnant. And then she gave birth. Then when she gave birth, initially the clinic kesihatan gave her Noriday. Then when she took Noriday, she's fine because she was also breastfeeding, so no period and everything is fine. But then after 6 months, I don't know why, she's still breastfeeding, but clinic kesihatan gave her combined pill. I'm so shocked too. Breastfeeding cannot eat combined pill ma. But luckily she came and see me. So I told her, no, you cannot take combined pill because you're endometriosis. Although she's happy now, she has no more period pain. But because she currently still don't plan to get pregnant. And whatever it is, I always say, whatever it is, you have to always presume your endo will come back. So you don't take combined oral contraceptive pill. So in her case, she was taking combined pills, so I changed her to a pure progesterone pill. Okay? Alright, so I have one more question. Doctor, if during menses and having constipation or diarrhea, can it be endometriosis? Yes, possible. You see, anything with endometriosis, whatever you feel, it's just worse during period. It can be more constipation during period, or it can be more diarrhea or diarrhea during period. Because endometriosis is a disease of inflammation, so it actually causes inflammation of the bowel. So we say when your bowel has inflammation, you have diarrhea. Like when you eat something wrong, then your bowel get inflammation. That is why you get diarrhea. So endometriosis causes inflammation during menses especially, so you get diarrhea during menses. Then why do they get constipation during menses? When your endometriosis becomes so bad, it actually goes around the entire bowel. You know, your colon is like a circle, and your endometriosis can go all the way, may not be all round, but most of it maybe. It seldom go to this part because it's always, the uterus is here, so the period is always here. So if the entire place here is already with endometriosis, and slowly it will make your bowels smaller and smaller and smaller. So during period, all endometriosis will swell up. So if you have endometriosis here and it's swell up, it actually, if it's so bad and so much of swelling, it actually make your bowels smaller. So you get constriction, which cause constipation. So basically, I always say simple principle. As long as you remember, anything you feel during menses is endometriosis. Doesn't matter what. Period pain, gastric pain, pain while breathing, urine pain, anywhere, backache, headache, whatever ache, anything you feel unwell or more uncomfortable during menses, it's always endometriosis. You have to think about endometriosis. Then she asked if after laparoscopy with Mirena, if got constipation or diarrhea, could it be still connected with endo again? Okay, when you put Mirena, you must understand Mirena is not like Visane. It is not as strong as Visane. So it will take a long time to work. It doesn't work overnight. It takes a long time to work. So the initial stages of Mirena, you may still find that you have diarrhea, you have constipation. But over a long time, it should go away. If it still doesn't go away, then it goes back to the principle that I mentioned earlier about program pain. You program your nerves, over time, that period equals period pain. Period equals diarrhea. Period equals constipation. That's how your body is going to behave, because you already programmed. When I explained the principle on program earlier in my previous videos, I already explained. It's like when you look at the lemon slices of lemons, your saliva comes out. The lemon did not go inside your mouth, your saliva already come out. When you cut a lemon, your saliva come out. You didn't even put the lemon in your mouth. What happened? It's programmed. Lemon equals sour. Sour equals saliva release. Because every time we eat something sour, our saliva will be released. Lemon equals sour. Sour equals saliva release. Program. Period equals pain. Period equals constipation. Period equals diarrhea. That's why if you are very confident that your endometriosis is already fully treated, then all this that you are suffering from is programmed. Especially if I give you Mirena or even Visane. I think earlier we had one video, somebody said that she on everything, it doesn't help. Then you really need to think whether it could be already a program cycle, especially if you're very sure that all your endos was removed. Okay, so yeah. Alright, let's see if I can squeeze in some more question. Yeah, one more question maybe. Dr. Tan, is it best to have second surgery and follow with lupine? Cause the first one, the surgery was done without clear everything. This question is asked by Nur Khatijah Abdul Rahman. Okay, she says she had a first surgery but didn't clear everything. Is it better to have a second surgery to clear everything? I think at the end of the day, we need to ask about why you need to be treated. If fertility is an issue, unfortunately, yes. Like just now I told you this case. My patient who saw me today, she operated, still pain, so she operated again by me 1 year after that. And then after, she has no more period pain, and she got pregnant, and now she gave birth already. If fertility is your issue, yes. Because you see why? You didn't remove everything. Then you want to get pregnant, which means that you cannot be on Visane, you cannot be on Mirena, you cannot be on any medication because you want to get pregnant. So what is going to happen when you do that? You're going to sit down and wait for your baby, right? But sometimes endometriosis is still there. You don't get pregnant so easily. Then what's going to happen? You keep sitting down waiting for your baby. Your endometriosis keep progressing. Then at the end, you're still going to have a surgery because you can't get pregnant. So then to wait 3 years later and do the surgery, might as well do now. Because 3 years later when you do the surgery, the endometriosis is even worse. And as I mentioned earlier in this video, what we don't want is for your endometriosis to spread to so many places, entire uterus, entire tube, entire ovary, until we don't know how to help you. Because we want to help you. So if you know that your surgery is not complete, please do it now. If you want to get pregnant. If you're not thinking about pregnant, then go on medication. Just go on Visane for the next 3 years, 4 years, and then after that Mirena. Just keep going on medication and medication and medication. Yeah, that will be a lot better. A lot better. Than to don't do anything. You still need to be on treatment because you know that your endometriosis is not totally removed. And of course, on top of that, the complementary treatment that I mentioned to you, dietary changes, physiotherapy, psychological therapy. All this does help. I have seen cysts that shrink because of complementary therapy, so it does control. Alright? So, yeah, that is my advice for Nur Khatijah, because I don't really know whether you're trying to get pregnant or not, so that's the thing. Alright, okay, so before I end today's talk, it's almost time's up. Let's look at some of the questions, because I know some of you ask questions that are quite easy to answer. Hi, good evening everyone. Okay, yeah, and all the endo fight. Yeah, good evening to all the endo fighters. So to everyone, this month is endometriosis month. Yeah, endometriosis awareness month. So that's why this week, this whole month, I'll be running my live video every week, Sunday 9 p.m. on endometriosis only. Okay. Okay, Chloe Wong asks, can breastfeeding mom take vaccine? This is my opinion. Okay, this is my opinion. All my staff in my clinic who are breastfeeding, because my clinic encourage breastfeeding and all my staff breastfeed. So those who are still breastfeeding, I told all of them to take the vaccine. I told them to take the vaccine. Why? Is because the only reason why they say it's not recommended is because the vaccine, of course, we all know is still new, because every time when we do a research, we do on normal people first. Then after that, we'll do on pregnant women, we do on children, we do on breastfeeding mothers, and then we go and study and see what happened. Okay, but there's, as far as I know, there's no vaccine that pregnant breastfeeding people cannot take one. Pregnant, yes. Pregnant, there's certain vaccine pregnant women cannot take one. Certain vaccine pregnant women can take. Certain vaccine pregnant women cannot take. But breastfeeding, don't have. Never heard of. It's just that they have not done the research, but never heard of. So take. To me, breastfeed, take. That's nothing. I'm not worried. If I'm breastfeeding, I'm not worried. I'll just take. It doesn't make sense that something will happen to my baby or my milk just because I take a vaccine during breastfeeding. No, I'll just take. But of course, it also must look at your risk. Like my staff, they're high risk. They're frontliners. They're high risk. We see COVID positive patients every now and then walking in and out of a clinic. So we know we are high risk. So that is why we need to make sure we are vaccinated. So the risk outweighs the benefit. The benefit outweighs the risk. So you better vaccinate. So then go back to you. You are breastfeeding. What are you doing? What is your profession? Because when people start vaccinating, everything is going to open up. Let's say you're a school teacher. You feed tons of children and you know children are all not vaccinated. And schools are going to open up. You're going to face the children. You are breastfeeding. If I were you, I'll vaccinate. because my children are not going to get vaccinated. All my school kids are not vaccinated. I better vaccinate myself because I meet a lot of people. So you need to understand, maybe now you work from home, but eventually there will be no more work from home. You have to come back and work and face everyone. So do you meet a lot of people in your job? Not just you. What about the people around you? The people that you meet at home, because at home you don't wear masks, right? You don't wear masks, you open masks, you eat with them. Those people who are at home, are all of them vaccinated? If everyone in my house is vaccinated, and let's say if I'm a housewife and I'm breastfeeding, everyone in my house is vaccinated. I don't meet other people much. The only people I meet are people in my house. Maybe I won't vaccinate first, I'll wait. But if I'm a school teacher, as I said, I meet children who are not vaccinated. And schools are definitely starting back. I better vaccinate. If I'm breastfeeding, I will vaccinate. Because my risk of getting COVID is quite high. Because I go to school and I meet children who do not vaccinate. So yeah, that is my take. So for my pregnant women who are all giving birth, I told the husband, you have to take, no question. Because if you don't take and your wife don't take, then who's going to protect your wife, right? So all husbands must be vaccinated. Yeah, the rest of you, you're asking mainly questions on endometriosis. So on endometriosis, I will leave it for the future talks, okay? Alright, that's it. Okay, so that's all for tonight. Just a reminder for all of you who are new, especially the ones who are new. So if you have missed my previous videos, okay, you can scroll down the Facebook or go to my YouTube page. My YouTube page link is in this video. Go there, subscribe to my YouTube channel, and also switch on the notification button, yeah, especially if you want more videos on endometriosis, because my previous endometriosis videos in this series, today is number 5 already, and my previous ones are still not uploaded yet. If you have missed it, you can always just switch on the notification button so that by the time we upload it, you will be notified by YouTube, and then you can follow the rest of it, okay? And but even without the last few videos, there are also a lot of endometriosis videos in my YouTube channel. Just go there and browse through all the videos there, okay? Last of all, yeah, just to let everybody know that I'm going for my vaccination on Tuesday. I will share with you my vaccination experience in my Facebook as well as on the video next week. I am so excited to go for the vaccination, and I hope all of you have already registered with my Sejahtera. And for those of you who always wonder whether endometriosis can vaccinate or not, no issue at all. Endometriosis does not cause problem to the vaccine, and vaccine also does not cause problem to endometriosis, so there's no connection. So go and register yourself for the vaccination program. As we say, lindung sendiri, lindung semua. Okay, so that's all for now. See you next week, Sunday 9 p.m, same day, same time. Bye bye.